Many pregnant mothers get complications when they're pregnant or even after the delivery. But also, the complications can affect their babies that they carry in their womb. This happens because there are a lot of changes that happens in a pregnant mother's body that makes them at a risk of having these complications or illnesses. So, you're welcome to Doctor's Television, and today we are going to look at those common illnesses that occur in pregnancy or that usually happen in pregnancy or during pregnancy. But before we go into there, hit that subscription button, click on the notification bell so that you do not miss out anything whenever we upload a video. So our point number 1 is the UTI or the urinary tract infection. Like it sounds, it is an infection or microorganisms or disease-causing agents in your urinary system that may include the urethra, the urinary bladder, or even the kidneys. So what happens when a mother is having a UTI? When a mother has a UTI or a urinary tract infection and it is not treated, it may cause problems with their kidneys. It may ascend to the kidneys. The infection may go up to the kidneys and cause more complications. Also, when you have a UTI and it is not treated, it may cause you or it may cause a pregnant mother to have a miscarriage and they miscarry their fetus. It can also cause the preterm labor. So if it is untreated or if you have a UTI that is not treated, it puts you at risk of having these complications. And our number 2 is the preeclampsia. Preeclampsia is simply a high blood pressure during pregnancy, but it usually happens when the pregnancy is about 20 weeks and above. So when you have high blood pressure or the hypertension in pregnancy and you don't treat it and you don't manage it, it makes you be at risk of having miscarriage. You can have preterm labor, you can have a delayed or restricted growth of the fetus or the baby that you're carrying in your womb. But also it can cause a more life-threatening complication that includes organ damage like the kidneys and the brain. Our point number 3 is the gestational diabetes. Gestational diabetes is high sugars or abnormally high blood sugars in your blood. So what will happen when you have diabetes mellitus in pregnancy? This usually happens also at 20 weeks and above of the pregnancy. So when you have diabetes mellitus in pregnancy that is not controlled, it will put you at risk of carrying or having a very big baby. You have a very big baby, and also it can cause preterm labor. But also it puts you at risk of having type 2 diabetes mellitus in the future, or even the same child or the same baby you're carrying in your womb is also at risk of having diabetes type 2 mellitus in the future as they grow. So we have very many other illnesses that could affect your you and your baby that you're carrying, including infections like the rubella virus infection. So it is, you can call it the German measles. And so rubella, like it is, like I said, rubella is an infection that is caused by a virus. But when a pregnant mother contracts this virus, then the mother is at risk of developing complications like having a baby with abnormalities. The baby with abnormalities like hearing problems, you deliver or you can give birth to a child who is having hearing problems. They don't hear well, or their hearing is, or they don't hear, or their hearing is having problems. They are not hearing normally. When you have this virus also, it may cause you to have or deliver a baby with the problems of the heart. You had some mothers give birth to children with defects in their heart, and here them they are flying to India for heart surgery or so. So this rubella virus puts your baby that you're carrying at a risk of having heart problems. They can also have brain problems or intellectual problems, and they are growing. Their intellectual ability is weak and grows very, very low. So when you have these infections or these viral infections, the rubella virus infection, it can also cause very many other complications. So there are other infections also, like the syphilis. Syphilis, you know, it is a sexually transmitted infection, but when you have syphilis, it may cause you to have a miscarriage. You miscarry the pregnancy, or you miscarry your fetus, which is very, very bad. But also, you can give birth to a child who is having syphilis. You deliver a child when the mother is having syphilis and it is probably not treated. The mother puts the risk of this child having the same infection. The infection moves from the mother to the child, what we call the vertical transmission. So syphilis can be transmitted from the mother to the child or the newborn, especially if it is not treated. And also the same syphilis can cause a mother to have miscarriage. The mother can miscarry their babies or the fetus. So you see the possible illnesses that can affect you and your pregnancy or your baby. During the time of pregnancy, during the time of delivery, or even after the delivery. So that's why it is so much important you have the antenatal checkups, because when you have antenatal checkups, especially when you have them in the time, these common illnesses can be earlier detected and be managed, meaning the risks of having or developing these very many other complications will be minimized. So that's why we always tell you, please have timely antenatal checkups, go to the clinic or go to the hospital when the pregnancy is still very, very young. During the early pregnancy or the time of during the early pregnancy, especially the first 3 months of the pregnancy, is very, very much important, and you're not supposed to miss out the antenatal checkups, especially in this period. That's why we say you should attend the antenatal clinics as early as 1 day pregnancy. So that means that you have to attend antenatal clinics very much earlier, and also you keep the appointment. You keep your appointment well, such that you're always examined and tested and assessed for all these possible illnesses that could affect you and your baby. You're still at Doctor's Television with Dr. Kasireka. Remember to hit that subscription button, click on the notification bell, so that you not miss out anything. But also remember to share and like. Stay blessed. Bye bye.